listen-only mode.
Good morning. Welcome to Diabetes and Prediabetes, the least you need to know. This is Lori Benison. I'm a worksite wellness consultant for Loveless Health Plan, and I'm pleased to have with me today Dr. Michael Grunn. He's the medical director for Loveless Health Plan and also our in-house diabetes expert. If you're expecting a slideshow today, know that there's not one, but Dr. Grunn does promise to be engaging enough that you won't even miss it. So before I turn this over to Dr. Grunn, just know that everybody's in listen-only mode. If you have any questions at all, you can email us at healthysteps@loveless.com. That's HEALTHYSTEPS at loveless.com, LOVELACE.com. If for some reason you get disconnected during the presentation, don't panic, just simply call back in. It will last about 30 minutes, and then at the end of the presentation, we'll send you an evaluation. It's important to us to evaluate what we do. It helps us to know how we can improve our upcoming webinars, so if you'll take a few minutes to complete that, we'd sure appreciate it. This webinar will be recorded and be available for future reference at the Loveless Health Plan website. So without further ado, Dr. Grund.
Good morning. I'm going to talk a little bit about diabetes and prediabetes and the least you need to know. Before we get into the least you need to know, we probably all should understand what diabetes is. Diabetes is a disease that causes your blood sugar to either elevate or go down. It's a disease of the pancreas, because that's where the body makes insulin, but it's also a disease of the small blood vessels. Now, as we go along today, I'm going to interrupt from time to time and mention what small blood vessels and what effect it has on the body. The normal range of blood sugar, according to the experts, is between 70 and 110. We've all seen some experts say, well, it's between 80 and 120, but it's in this general area of 70 to 110, maybe a tad higher. If your blood sugar gets low and too low, let's say it gets in the 40 range, then you can have some dire consequences. The same thing can happen when your blood sugar gets too high, say above 500. You can also have a different set of consequences. If your sugar gets below 40, you can become weak, disoriented, and eventually get comatose. Now, interesting enough, if your blood sugar is high, really high, over 500, you can also become comatose. But let's go back to the low blood sugar. We've all heard stories about how some dogs are able to tell if the people they live with or their masters are coming down with or have cancer. They're able to tell that. I'm going to tell you a personal story about my dog who was able to detect while I was asleep that my blood sugar had dropped in the 40 range. She jumped up on the bed and started nudging me with her nose, and then she started licking my face, and she'd never done that before. So somehow she knew that my blood sugar was low, woke me up, and kind of led me into the kitchen to get some glucose tablets. Sometimes our dogs are smarter than we are. Let's look at the other extreme where your blood sugar is high, say it's in the 500 range or above. You start to develop ketones in your blood and in your urine. What this causes is for your whole system to become acidotic. You will also If it gets bad enough, you'll become comatose and develop an electrolyte imbalance. What happens at this point is, if you're lucky enough to get transported to the emergency room and they check your sugar, they'll admit you to ICU, start you on an insulin drip, and start replacing some of the electrolytes that you're losing. In this case, it's sodium that's lost when your blood sugar gets too high. So what is diabetes and how do we get it? Well, that's an interesting story in itself. One of the theories is that we get it through heredity. We get it from our parents, or we get it from our ethnic background. If our parents have if our parents are insulin dependent, both parents, then there's an excellent chance that we, as their offspring, are also going to become insulin dependent sometime during our lives. Now, in my case, both of my parents were insulin dependent diabetics, and it didn't take long for me to become a diabetic, and I have two brothers who also became insulin dependent. So heredity on an individual basis may cause diabetes. Another factor is our ethnicity. I think researchers have shown us that there are certain ethnic groups that are more prone to become diabetics. The two I can think of right off the top of my head are Jews from Eastern Europe, the Ashkenazi Jews, and there's a high proportion of insulin-dependent diabetics in that population. Another group is Hispanics. When I was living in South Texas, I was able to see firsthand the propensity of this group to become insulin dependent. I think in some areas of the country, blacks are also at a higher risk, as are Native Americans. One of the other factors that may cause some of us to become pre-diabetic is obesity. You can take the same person, have that person gain 100 pounds, and suddenly we go from normal blood sugar to a blood sugar that's high or low. So one thing, if you have a family history or the ethnic background, don't let yourself become obese. You must lose weight in order to control your sugar or to bring it down. Diet is also very important for people with prediabetes or diabetes. It's not unusual for a pre-diabetic as a youngster to crave sugar. Or is this just an excuse to have something sweet? It appears that there may be a craving for sugar on the part of youngsters. I think that needs to be investigated, and perhaps we can come up with some sort of an answer for that. So how does diabetes affect us? Well, the obvious thing that it does, it affects our blood sugar. Our blood sugar is either high or it's low, or we've got it under control. But some of the less obvious ways that it affects us is our level of consciousness. If our sugar gets too low, we get lightheaded, disoriented, clumsy, difficulty walking, difficulty in concentrating, and we can certainly become comatose if our sugar gets too low. In my case, it's about 42 or 43. When my sugar hits that point, I need help immediately because I may not be able to help myself. It's the same thing with if our sugar is too high, we can also become comatose. And we follow that scenario we discussed a few minutes ago where our sugar is high, We become disoriented. Somebody takes us to the hospital, to the emergency room. They start giving us insulin, start an IV on us, replace sodium, and then transfer us to ICU. So the important thing if you are a diabetic is you need to understand your medicine, understand your diet, and exercise. I want to tell you a brief story. About 10 years ago, I was asked to make a presentation to the diabetics who were working at the John Deere works in Dubuque, Iowa. And they asked for me to come during a lunchtime and give a presentation on diabetics and answer some of their questions. So we went through some of the things that we've already talked about. And then as a exercise, I asked everybody who was in attendance to open up either their lunch pail or their bags or whatever they had brought their lunch in and lay their lunch out on the table. Now these were people who knew they were diabetics. Almost 100% had either high sugar cupcakes, ding-dongs, or pie, and they knew they weren't supposed to do it, but they did it anyway. I'm not enough of a sociologist to figure out the reasoning behind that, but every one of them had been to see a diabetic educator, and they were told what they could eat. They were also told the number of calories or the number of carbs they could take in during the day, yet here they were all cheating at lunchtime. Diabetes has also been called the disease of small blood vessels. It can affect your vision, and it can affect your kidneys, as well as your heart. People who have been diabetics for a while will develop diabetic retinopathy if their sugars are not well controlled. What this means is that the small vessels of the retina are attacked, and you can lose or have diminished vision and then lose your vision if you don't take care of yourself, if you don't take care of your diabetes. That's why diabetics on every time they see a physician, they should also be referred to either an ophthalmologist or the other kind to have their eyes examined so the doctors can look into the eye with an ophthalmoscope and see if there's any developing retinopathy. That's a good clue that you're not taking care of your sugars. So diabetes is a disease of the small blood vessels going to the eyes. It's also a disease of the small vessels of your kidneys. Diabetics, especially those whose diabetes are out of control, will develop protein in their urine, and your doctor should check that at every visit. Once you've got protein in your urine, and your urine is checked with the BUN and creatinine, you'll see that those numbers are getting worse every year, and you have to be observed very closely to make sure you don't go into chronic kidney failure or renal failure and need dialysis. The other way that we can see that diabetes is a disease of the small vessels is look at your lower extremities, especially from the mid-calf on down. Diabetics are prone to develop bruises which become ulcers. They can become necrotic, and they're extremely difficult to heal. Diabetics are known for wounds anywhere in the body healing slowly But in this case, they may not heal at all. The further down the leg you go, the harder they are to heal. And if you have ulcers, diabetic ulcers on your ankles or on your feet, and you don't get them addressed right away, they can become worse. They won't heal. The infection will spread from the soft tissue to the bone. You develop osteomyelitis, and then you're at risk for amputation. So diabetics need to be aware of that. Even though they may not have other problems, their sugars may be just a little high, but they can still develop diabetic wounds in the lower extremities. So remember, eyes, kidneys, legs, and also we're learning now through studies that diabetics are at a greater risk for coronary artery disease and myocardial infarction than the rest of the population. So it's not just a disease of blood sugar, but it affects your eyes, your heart, your kidneys, and your legs. When you start to lose the level of consciousness, when your sugar starts dropping, you start acting and walking and talking goofy. Nothing registers. Your speech is slurred. You can develop ketone breath if your sugar is high, which it smells like fruit, and sometimes it's mistaken for alcohol. But there is a distinct difference between a ketone breath and alcoholic breath. We become unsteady on our feet, our speech is slurred, and our wounds won't heal, our kidneys are failing, we're at increased risk for coronary artery disease, and we're slowly becoming blind. The problem with some of these is that it's not reversible. So even if you suddenly get religion and start taking care of your sugars better than you have been in the past, the damage may have already started. So how do we treat elevated blood sugars, diabetes? We treat it with diet, exercise, awareness, pills, and when the pills stop working, then we start taking insulin. Insulin can either be short-acting or long-acting. Some diabetics, if their disease has progressed far enough, will take both kinds. They may take a short-acting insulin after meals, and they may take a long-acting insulin at bedtime to get them through the night. When that happens, you can almost be assured, when you need both kinds, that your pancreas has stopped making insulin, and so you have to replace all the insulin that your body was manufacturing, and you replace it by injections, usually 5 to 10 minutes after you eat, 3 times a day, and you take insulin again at bedtime to cover those hours where you're neither eating nor taking insulin. The key to treating your diabetes is comply or suffer. Understand what diabetes is, understand what you have to do. And if you haven't already done so, insist that your physician send you to a diabetic educator, usually 2 or 3 visits to reinforce what you've been told will do the job, but insist that you go and you learn how to take care of yourself. You will learn what to eat, how often to eat, and what to avoid. You'll be taught about exercise, how to plan meals, how to take your insulin, when to take it, And if you don't, you're going to suffer the consequences. You'll suffer the eye problems, kidney problems, heart problems, and whatever small cuts you get on your legs are going to become a lot worse. So for a way to take care of yourself, and the thing to remember is be on guard. Be aware that these things can happen to you. Understand that in the future there may be an oral insulin available to the population if it's not already available now, so you don't have to take injections. We know as professionals that not everybody can handle injections. Some are deathly afraid of them. So there is or will be shortly an oral insulin on the market. There will also be an inhaled insulin, another way to take it, so we don't have to take injections. If diabetics are difficult to control, in spite of doing the very best they can, there are two other devices that are out there. One is a continuous glucose monitor, which has a little needle on the end, and it gets stuck into your side or the soft tissues somewhere on your body, and it reads out what your blood sugar is. Along with that is the insulin pump, which will pump insulin into your body without you having had to do anything about it, because it recognizes when your sugar is high and how much insulin you need. We see a lot of juveniles with that. So the key to staying healthy is test yourself frequently. So what does frequently mean? Minimum of 2 to 3 times a day. And if you feel like you're having problems, test yourself more often. And if you're an insulin-dependent diabetic, always carry your glucose tabs with you wherever you go. Keep some in your car, keep some at home, keep some in your purse. If you go out on the golf course, take some and put them in your golf bag. Diabetics are prone to become hypoglycemic on the golf course. So that, and understanding that if you have the opportunity to talk to or teach a diabetic, the key word is test yourself frequently. So thank you very much for your time and attention, and I appreciate it. Thank you.
Well, thank you, Dr. Grun. You definitely delivered on your promise to be engaging. Your personal experience with diabetes and your passion to share strategies to managing diabetes effectively with others is evident. We definitely appreciate your support. And for those of you who would like some additional support, at Loveless Health Plan, we have 2 complementary programs that may be beneficial, our Healthy Steps Coaching Program and our Healthy Weight Program. Our Healthy Steps Coaching Program can provide a coaching service that can help you when you're confronted with decisions or treatment options, and also help you manage or prevent diabetes. You can speak to a coach by calling 1-800-390-9159. Again, that's 1-800-390-9159, or you can communicate online at lovelesshealthplan.com. Our Healthy Weight Program is a 10-week individual telephonic counseling program that focuses on lifestyle change. The program centers on adopting healthy eating behaviors and regular physical activity. It's designed to help you develop the knowledge and skills needed to achieve and maintain a healthy weight. You'll also receive a packet of tips and tools to assist you in your efforts if you join that program, and you can join by calling area code 505-727-5344. Again, it's 505-727-5344, or you can call us toll-free at 1-877-480-9368. That's 877-480-9368. 9368. Thank you so much for joining us today. Our next webinar is going to be on Wednesday, May 25th, and the topic is on women's health, staying healthy at any age. We'll see you then. Bye-bye.